Welcome back to Skinfluence, the podcast that is your one-stop shop to all things dermatology, skin health, wellness, and whatever else we find interesting. We want to talk about.
all of our bad jokes.
And all of our bad dad jokes. So we are today going to be talking about rosacea. I'm Dr. Dustin.
I'm Austin Lee, physician assistant.
And so rosacea is one of the most common things that we see in the clinic.
Yes.
And unfortunately, there's no cure yet.
There's no cure for we're starting off on a positive note.
It's hopeless.
It's hopeless.
No, we can make it a lot better in many cases. So, but we should probably talk about what it is and who gets it.
So rosacea, or commonly known as adult acne, is an inflammatory condition of the face with a few different etiologies or a few different reasons why it can happen. And sometimes it's hard to tell exactly why, but we know that it is inflammation happening in the face. Yeah. It will show up as a few forms. One is what we call the erythrotelangiectatic type, which is just background redness or flushing. It usually will show up on the cheeks. One of the clues that I use in clinic, and you probably do too, is it will often spare the eye well. So they'll have this bright red area or faintly red area, but just the eyes are untouched. It'll also spare right under the nose very often, but it'll cover kind of the cheek nose area. It can happen on the forehead, the chin, the chest, the neck, and areas as well. But that's kind of that background blood vessel-y look. Then we have what's called the papulopustular variant, which is the acne-like bumps. Now, very often when you ask your patients, they say, you say, do you get a lot of blackheads with this? And they say, I get no blackheads. It's just kind of red, angry bumps and sometimes pustules. And that is kind of a classic sign of rosacea. The third type that we see is called rhinophyma, and this is your nice, bumpy, glandular grandpa nose that you see mostly on men. It can happen in women, but it's a little bit more rare.
Yeah.
But that is kind of what we look for in terms of what rosacea is. It's inflammation happening in the skin that shows up in these different forms.
Yeah, and these presentations vary widely. Sometimes it's hard to believe it's all the same disorder, but the pathophysiology happening in the skin of this inflammation, and our cells are releasing something called matrix metalloprotease, which can increase the development of new blood vessels, and you get literally, you can see new vessels forming, really common around the edge of the nose, and that'll happen in all types. And there's different treatment approaches to each of them. Now, you mentioned that the rhinophyma type, definitely more common in men.
Yep.
All of these are generally more common in fair-skinned individuals,
Yep.
kind of like Western European heritage, Scottish, Irish. You got fair skin, and you get that red flushing look. Then you start to develop the papules and pustules, and sometimes it is progressive. You get the redness. A few years later, you start developing the acne, and then it goes on and you start to develop rhinophyma. Most people don't progress, but it can progress in that way.
Yeah.
Happens primarily in adults. I think that the erythrotelangiectatic, the red kind, I see a lot of women with that. Yeah. The rhinophyma, definitely more men.
Totally.
And the bumps, kind of both.
Mixture of both, yeah.
So now the rhinophyma, it's called phymatous rosacea. So rhinophyma is just specific to the nose.
Yeah.
But you can also get naphtophyma, which is the chin. So you get that hypertrophy of the oil glands on the chin. And then there's one that just affects the earlobes.
Yes.
And I remember having a patient who came in and his just earlobes were tender and he'd been to lots of different derms. And I didn't even fix him. I just told him, I know what this is. This is what it's called. And this older guy literally cried that somebody actually just had an answer for what was going on, why his earlobes were getting huge.
Yeah.
And then I was in residency, and so it was one of those situations where I got him started on treatment, but I never got to see him back because you're rotating through different clinics. And I wish I could have seen how he did ultimately. It can also just affect the forehead, where people just, I don't know, like Klingon style, their forehead just starts growing.
Just a little redness.
So there's different presentations, and we'll get into the treatments here in a little bit, but I think it's important to kind of set the lay of the land for what it is, what it looks like, the different types that one could experience.
Yeah. And there is another type that we see maybe occasionally called ocular rosacea.
Yeah.
Which is rosacea. It affects the eyes. And so sometimes I'll ask my patients, do you get dry, scratchy eyes? And they say, yeah. And I'm like, okay, well, that tracks with what I'm seeing on the face. I've had a couple of patients where they come in and they're complaining of dry, scratchy eyes. And they've been to a bunch of different doctors. Eye doctors don't know what to do. They're doing like steroid eye drops or they're doing other types of things. And you see that background redness, just subtle, and you go, I think you have ocular rosacea, and there's things we can do to try to treat it, and it can help calm down some of that inflammation.
Yeah. And as far as triggers, this is something I cover with every patient, is potential triggers that make this worse.
Yep. I have the most common ones that we go through, but so typically there's environmental triggers, food triggers. Environmental typically being sun, heat, and sometimes wind. And then the food triggers, the most common ones I cover are spicy foods, tomatoes, hot drinks, alcohol, caffeine, coffee, those types of things.
So those are all things that can do it. I've seen people that get super flushed just with exercise.
Oh yeah.
So getting their body temperature up a little bit. And it's really difficult if you have one of these triggers and it's a food you love or an activity you love to participate in.
Yeah.
Because trying to manage the disease when you're doing something that's causing it to get worse it just makes it really challenging for patients. I think we should also touch on the Demodex mites.
Oh yes. Our good friends.
Demodex. You have mites that live on your skin.
Patients love hearing this.
Yeah. I'm like, don't worry. I do too.
It's not just you.
So there's these little tiny mites. They're living on your face. They go down next to your hair follicles, in your oil glands. And everybody has some, but in some individuals, the mites carry their own bacteria, and your immune system doesn't like that bacteria, and you start reacting. And the mites they're living off the oil that you produce, and if they really like it, they'll have more mites that will develop.
Mite parties.
And in my opinion, it's a very distinctive look when I know somebody has Demodex as the cause of their rosacea. They get pustules, but they're these tiny little pinpoint pustules.
Yeah.
And I see that and I'm like, I know I can get you better.
Yes.
And it's exciting.
It is exciting when you have that feeling.
And so, but that's one of the things that can also cause ocular rosacea is these mites will go down the follicles of the eyelashes. And people are grossed out by it sometimes, but it's one of those things as a dermatologist, when you make that diagnosis, like it's really fun.
Yeah, it is fun. I've had quite a few patients say that they're like, I feel disgusting now. And I'm like, no, it's normal. Like this is a normal thing. But yeah, the thought of mites crawling your skin just can make your skin crawl a little bit, I guess. But
so if you have rosacea or just that sensitive skin with the flushing, maybe you have the acne rosacea type, or you're getting, a little overgrowth of the nose. Let's talk about the things you should not be doing to your skin before we get into all the treatments that are available.
Yeah. So because this is a condition of inflammation, anything harsh on your skin. So a very common mistake is people think, I'm getting acne again. And so they start using harsh face washes or salt scrubs. So they feel like there's dirt, that maybe it's like an oil thing or a dirt thing. We need to get that out. And all those things can just elicit more inflammation and make it worse.
When you have rosacea of any type, your skin barrier is not functioning properly.
Yeah.
And if you're using retinol nightly, if you're using AHAs or BHAs or the scrubs, you're further compromising your skin barrier, and your rosacea will continue to get worse. It's not going to fix the acne part of it.
Yep.
And so those are things you just have to stop doing. And if you know that you have a particular trigger, you really should try to cut it out. Now, if your trigger is exercise, I don't want you to stop exercising, but maybe find a different type of exercise you can do. Like if you are a hot yoga person and you flare, like maybe find a different exercise. I don't know.
So totally.
Alcohol's a big one.
Alcohol's a big one.
Yeah.
A very common story. I'll ask my patients, when you wake up in the morning, I would assume it's not flaring really bad right now, but then by like 10 and 11 or 11 o'clock, you're starting to flush or get new bumps. Is that accurate? And they say, totally, that's exactly how my day goes. And I say, do you drink a cup of coffee every day or have an energy drink in the morning? And they go, yeah, totally. And I'm like, yeah, well, it's that caffeine, it's the coffee, it's the hot drink or whatever. And
causing you to flare up a little bit. So, well, now that we've laid that out, we've got treatments to discuss. But first, a little did you know?
All right. I kind of have a fun did you know today.
Okay.
It's a story about a patient I had with rosacea. And so I had an older gentleman come in, probably in his late 50s, horrible papulopustular rosacea with the background redness and everything. And after some questioning, I find that he was a very heavy drinker from like 11 in the morning and on. Like started early.
Yeah.
Every day. He just like he worked a job where he worked mostly in the evening and then through the night. And so he would drink early on and then basically up until exactly. Yeah. And it was like, okay. He was very perturbed by his rosacea. And when I had discussed with them that alcohol is a common trigger and it's probably making it worse, he kind of put his head down and was like, okay. And I prescribed some medications, and then he came back. I usually do a 2-month course of whatever we're doing, and then he came back, and his rosacea was almost completely gone. And I was like, you're using the medications? And he was like, nope, I never picked him up. I stopped drinking.
Oh, no.
And I was like, okay, are you doing okay? Like, how's life going? He's like, my relationship with my family is way better. Like, my life's way better now.
You like solved everything for him.
It took rosacea.
It's funny that was like the thing that got him to do it, though.
Yeah.
Like,
I was blown away. I was like, really?
I mean, no doubt he knew like home life was not good and maybe his work was suffering and he wasn't happy, but like it took his appearance to be the thing that got him to make that change.
Like, we can improve this with stopping. And I think that's all he heard in that visit was alcohol's causing this. And so
that's phenomenal. So my case is about the time that I gave somebody rosacea. So I had an older gentleman who came into the clinic and had some perioral dermatitis, which can be a subtype of rosacea, essentially. And it's one of those things where I didn't want to give him a steroid to put on it. I think he'd tried some clindamycin before. It didn't really get better. And so I gave him something that is a topical calcineurin inhibitor called pimecrolimus. The brand name is Elidil cream. Because it's not a steroid. It's very safe. It's not going to thin the skin. And so he had started using this, and he put it on, and then he started getting bumps around the area that he put it on. And so he'd put more on, and then it would spread, and he would get bumps. And he started using more of it, and the bumps grew. And he was putting more and more Elidil on, and the bumps just kept going. And he came back, and he thought, like, this isn't working. Like, it's just getting worse. And I'm like, this looks different. And he had tons of these little tiny pinpoint papules. And I was like, I don't know. So I did a scraping. So I took a little mineral oil and a 15 blade, and I just opened up a couple of these pustules and got the pus out, and I put it on a microscope slide, and I went and looked, and there were dozens of Demodex swimming, flapping their little arms. They were still alive.
They were so happy.
And essentially, I took his problem, and the topical calcineurin inhibitors suppressed the immune system in the skin. And these Demodex mites just had fertile ground to explode. But literally dozens of Demodex mites, all alive on the microscope slide, and just that you can see their little arms flipping around.
That's wild.
So I took out my phone and I recorded these things through the microscope eyepiece. I still have them, and I've done TikTok videos on these things. So if you see me post about Demodex, it's from this case, where these little Demodex are just kind of floating around in space with their little arms just flapping.
That's crazy. I can see their tiny little
And so I ended up writing that up as a case report that like tacrolimus or pimecrolimus caused this presentation by suppressing the cutaneous immune system, and it got published in, I think, the journal Cutis. So
that's interesting.
But at that point, we switched him over to topical ivermectin, which is the most effective treatment for the Demodex mites. Cleared up, super happy.
Gone.
But I've always remembered that case. And I'm always,
That's
whenever
kinda
I give somebody Elidel for the face, which I still do for eyelid dermatitis and things, I'm always like, I hope this doesn't cause the Demodex to explode.
Yeah.
So
that's crazy. I think the most I've ever seen in a slide is maybe one.
Yeah.
Like they're not super common.
I had tons of them on the slide.
That's crazy.
And everybody in the clinic came and looked.
Yeah.
And I think I showed him on the phone, like the video that I took. And like, this is on your face. And he probably wasn't as fascinated by it as I was.
That's amazing. It's your classic dermatology, like things that make you happy.
Just super nerdy. So now that I've confessed to causing rosacea in a patient and we've told you all about it, let's talk about how to treat it, because there's things you can do over the counter and there's plenty of prescriptions that we have available, and we're going to break it down for you.
Yeah. Well, I'll start off with one of my favorite over-the-counter products for rosacea are niacinamides.
Yeah.
They're going to help calm down some of that. They're going to help repair the skin barrier, calm down some of the inflammation. In terms of over-the-counter, that's kind of like your Swiss Army knife of things that will help with rosacea. We've talked about this before, but avoid harsh actives, basically retinols, retinoids, BCAs, ACAs. All of those are going to kind of aggravate things.
Yeah. I get all of my patients on just really a gentle cleanser, something like a CeraVe Hydrating, Cetaphil Gentle Cleanser, La Roche-Posay Tolerion Gentle Cleanser. And then sunscreen's absolutely important when you have rosacea, because again, UV rays is one thing we didn't talk about, as the sunlight causing flares of rosacea. And if you protect yourself from the sun, you're going to have fewer of those blood vessels developing and things like that.
I think I said BCA. I meant BA. BA. Yeah. Branched chain amino acids. You got to watch out for those.
Yeah.
Yeah. Sunscreen is essential.
I like the niacinamide. Every one of my patients gets a really good moisturizer if you have rosacea, because again, trying to repair that barrier. And so those are things that they're not even specific treatments, but they're things that do move the needle and help to improve rosacea. If you're doing gentle skincare, good barrier repair with a moisturizing cream, and you're going to get a long way just with that. And I love Cicaplast from La Roche-Posay, Ciclofate from Aven. La Roche-Posay just released, I think it's called Rosacea.
The Rosacea AR.
Rosacea AR.
Yes.
Rosacea. I've said it wrong to every patient today. Rosacea. But it's a really good moisturizer, but it has a little bit of a green tint to it.
Yes.
So it kind of masks the redness of the skin. Really good option.
Yeah. The interesting thing about that one is they studied that over, I forget how long, a decent period of time, and it showed reduction in the redness over time, which there's not a lot of products that will do that.
Yeah.
So
when it comes to the things that you can treat with over the counter, you mentioned niacinamide. Azelaic acid is another one that I recommend frequently on social media. If they're in my office, we'll be prescribing that, usually at a little higher dose. But azelaic acid can treat acne. It's safe during pregnancy. It treats rosacea, has some anti-inflammatory properties. So it's one of those things that has been a standby treatment for rosacea for a long time. And it's available up to 10% over the counter.
Yeah. An interesting thing about rosacea that I found in speaking with other dermatology providers is how they approach treating rosacea varies widely. Everybody has their go-to medications, but it's very often different approaches on how they want to do it, what combination of topicals are they using. So when it comes to prescription topicals, which ones do you typically use?
So for a prescription topical, the first one that I go to in many cases is still metronidazole.
Yep.
So metronidazole cream, metronidazole is an antibiotic. We don't use it a lot as an antibiotic anymore. There's certainly like trichomonas, we still use it for, I don't know if it's used for Giardia. Maybe. I don't know. I
haven't treated Giardia ever, so Giardia.
But it's used for trichomonas, which is an STI, can be an STI. And so metronidazole cream, I think overall works pretty well. If you have background redness, it can slow down the progression of the redness. I find that it works pretty well if you have the pimply type, the papulopustular rosacea, I will use it on my rhinophyma patients as well. And I find that it helps. And that's probably first in my treatment algorithm if they want a prescription topical that's often covered by insurance.
Yeah, that's typically where I'll start as well. If I'm seeing a lot of just the inflammatory papules and pustules that are bigger and angrier, sometimes I'll use like a pimecrolimus or tacrolimus or something along those lines as well.
The next one that we use a lot is azelaic acid, but prescription strength.
Yes.
And so we go 15%. There's a 20% also. I've used azelaic acid, just trying it out for acne or just because I wanted to try it. I didn't love the way the 15% felt on my skin, but like 10% over-the-counter options feel fine. But it just kind of stung almost.
Oh, really?
And maybe that's just because the vehicle wasn't very good. I don't know.
Yeah.
But I've generally found that it works well for patients, and we combine it in something called triple cream a lot.
Yes.
So triple cream gets us to our third topical that we use a lot for rosacea, which is ivermectin.
Yes. Somewhat controversial sometimes.
Sometimes.
But it has been FDA approved since before COVID.
Yeah.
So since 2017, ivermectin has been FDA approved to treat especially the papulopustular variants of rosacea, which you have discussed. So it treats and actively fights against the Demodex mite, which is often a big driver in rosacea. It came in a brand name Soolantra. Now, very often we get it from compounding pharmacies where they'll put that in as usually the first ingredient with things like metronidazole and niacinamide or azelaic acid or things like that.
And so that's one of the things that if the patients can afford the compound, which insurance companies don't cover compounded medications, and they're not getting better just with metronidazole alone, we just do triple cream. And it's got the azelaic acid, ivermectin, metronidazole, and often with the niacinamide that you said, so almost like a quadruple cream.
Yeah.
And patients love it.
Yes.
Like it works really well.
I've had great success with it. It's often my go-to. I'll start patients just on that.
Yeah.
And then outside of topical therapy, we do use oral medications at times to try to treat especially more inflammatory type papules and pustules. I typically will, if I'm seeing a lot of those and the patient really, you could tell it really affects them, they want it to go away quickly, I will use doxycycline, usually starting at 50 to 100 milligrams once daily. Obviously, I have them take it with food to avoid excess sun, things like that. But that can help get things under control. We never really want them on antibiotic for very long. So once we've got it under control, we'll try to maintain with just the topicals.
Yeah. So doxycycline is an antibiotic that we still use in a lot of things. It, in most cases, covers MRSA infections. And so we don't like to keep them on higher doses. There is a brand name called Rosacea that is 40 milligrams delayed release. And so you get this slow release of the doxycycline. And the idea here, and the studies have shown, that this is a sub-antimicrobial dose. We are not trying to kill bacteria when we use doxycycline for acne or for rosacea, but it has anti-inflammatory benefit once it gets in the body. And they have found that at 40 milligrams, you get the same anti-inflammatory benefit as you do at the 100 milligrams. I don't know that I've always appreciated that. I find that some patients definitely have just done better at the hundreds.
Yeah.
And the problem is the Rosacea is quite expensive.
Yeah, it's a brand
name. And the generic version is what we call a branded generic. So it's made by the exact same pharmaceutical company, and they still charge a lot of money even for the generic version.
Yeah.
And so if I want that lower dose, doxycycline to absorb the best, you should take it on an empty stomach. But it causes so much stomach trouble and irritation that I tell patients to take it with a little bit of food, like some bread or crackers, not with calcium. And then I know I'm sacrificing some of the absorption, and this is just my bro math, I guess, that I'm like, if I give you 50, you take it with a little bit of food, probably going to absorb like 40. But I don't have studies to back that up, just to be honest with the audience. But, sometimes I just have that gestalt that patients need that little higher dose to get clear, and then back them down to the 50s.
Yeah.
So now minocycline can work well also. I just don't use a lot of minocycline because I think it has more side effects as a possibility. If they can't take a doxycycline, I've occasionally used azithromycin.
Yeah.
But again, all of the goal of these is not to keep you on antibiotics for a long time.
Totally. It's to get it under control and then maintain on topicals. But yeah, I've never been written azithromycin for this. Minocycline occasionally.
Yeah.
But again, it yields a little bit, it has more side effects that could potentially happen, and we're looking to not cause any side effects in our patients. So
I've had a couple of patients that were prescribed, I recommend it, it's not a prescription, but a high quality probiotic.
Yeah.
And I've seen improvement in rosacea from using a high quality probiotic.
Really?
Mm-hmm.
I should probably
the
start.
one that I've recommended, which I don't have an affiliation with, is Pendulum.
Okay.
So it's the Metabolic Daily from Pendulum Health. I think it's a really good probiotic.
Good. Yeah, that's interesting.
And then, and as you said, most of these are done in combination. We're not just doing an oral antibiotic.
Yeah.
I don't think I've ever just prescribed an oral antibiotic for somebody. I'm like, if I'm giving you this, we're going to do a topical because I'm going to take away the antibiotic eventually.
Yep, that's exactly right. I do the same thing.
If somebody has phymatous rosacea, they need an antibiotic though.
Yes. Yeah. Doxycycline typically is our main go-to for that type of rosacea, as well as ocular rosacea. Mm-hmm. It's been amazing actually seeing the decrease in inflammation in ocular rosacea and doxycycline. The hard part is there's no topical to replace it with. And so then we really try to lean into the lifestyle changes at that point.
Yeah. Now, the other thing that I'll do, particularly in phymatous rosacea and sometimes in really stubborn papulopustular rosacea, is low-dose Accutane.
Mm-hmm. I actually have I have a few patients right now who have just very stubborn rosacea, and we have them on Accutane, and we know going into it, like you probably do the same thing. I explain that this is really nothing that we have done is able to get this under control. It's very likely that the rosacea can slowly come back. It's not curative like it is to acne, and so after this, we'll talk about some things that we can do to try to maintain you clear.
Yeah. When I use Accutane for rosacea patients, it's usually, we know it's a chronic condition, and instead of dosing them every single day like I do a teenage Accutane patient that has acne, we'll do maybe twice a week. They just take the pill twice a week, and it's enough that they don't get terribly dry skin, they don't have increased sun sensitivity, but it's enough to limit the oil gland production that nose actually shrinks down a little bit. They get symptom reduction. They're much happier. It's one of the most satisfying follow-up visits because these guys come in, they're concerned that their nose is getting bigger, and they're like, I love this. This is amazing. I never want to stop taking it because they don't have any side effects either.
Yeah.
And generally at low doses, it's really safe to do.
Totally.
And I've had some patients that have done it for twice a week for 4 or 5 years.
Yeah.
And we'll occasionally check labs, or they're usually getting labs with their family physician, and we get copies of those to make sure that there's not an impact on the liver. But at that dose, it's so rare that there's anything that will be wrong.
Yeah, so that's awesome. So when you're managing a patient with rosacea, we know and we communicate that this is, there's no cure for this.
Yeah.
Like we said at the beginning of the episode. There's no magic treatment regimen that it's going to go away and then you can stop and then go away.
Yeah.
What are some lifestyle things that you walk through with your patients to help them maintain clearance once you're able to achieve it?
Yeah. I talk with many patients just about eating a good diet, avoiding processed foods, refined carbohydrates, just the more whole foods that you can eat, the more active that you can be physically, controlling blood sugar, blood pressure, cholesterol. I see better outcomes in people that take care of their bodies.
Totally.
Getting good sleep, gentle skincare. Those are all things that are very accessible to the average patient and will make a difference in your skin.
Are there laser treatments that can be beneficial for people who have rosacea?
This is something that can be really helpful, and it's really good for those patients who have just the background redness and the flushing. And the topical treatments, the oral antibiotic treatments, Accutane, just don't work as well for these patients. They're not getting the pimples. And so it's the most common type of rosacea and the most difficult to treat. But things like a pulse dye laser or BBL or IPL that will go in and it'll actually target the blood vessels that have formed below the skin and get them to go away, can really eliminate that background redness. And it's really satisfying. And I've got in our EMR some amazing before and afters on patients who went through BBL or pulse dye laser when we had that, and just brightened their skin, got rid of so many blood vessels. And even for papulopustular rosacea can make a big difference.
Yeah.
The question that every patient asks is this covered by my insurance? And unfortunately not.
It is not.
Insurance companies do not like to cover anything that has to do with lasers.
No.
And so it is one of those things that you have to save up for, but the results are very predictable of improvement, a brightening of the skin, a more even complexion. So lasers can be miracle workers in rosacea.
Yeah. One of the things that I typically will recommend is if people are struggling with rosacea, and especially the redness that you talked about, I will send them over to our esthetician to do. We offer the BBL laser, and it's the before and afters are just amazing.
Yeah.
Which is awesome.
If you have phymatous rosacea where your nose has started to grow, I've used the CO2 laser to debulk, and literally we just melt away some of the tissue and reshape the nose, which is a really satisfying procedure.
Yeah.
It's something we numb the patients up really well. We have to have a smoke evacuator because we're creating a lot of char on the skin, a lot of plume coming off. But there's so much oil glands and stem cells there that they heal really well.
Yeah.
And they're generally very happy with that. And there's been times I've been just out in public and I've seen somebody with really bad rhinophyma. I've never done it, but I've wanted to be like, I can help you.
Okay.
Here's my card. Like I would do it for free because I just want to see the before and after.
Yeah. And it probably changed their life.
Yeah, absolutely.
Yeah.
So lasers can be really helpful
Totally.
as part of the treatment of rosacea.
Yeah. Another thing is that this is a very common condition.
Yeah.
We see this in so often during the day. I mean, I see it at least 2 or 3 times a day, and that's just me. And then there's multiple providers in this clinic. But there are so many people who struggle with rosacea. A good resource for anybody who is struggling with this, wondering what to do, is a website called rosacea.org. Rosacea.org will go through every type of lifestyle change you could possibly make, every type of trigger well beyond what we've discussed and what I typically discuss in the office. And so people who are really like, I want to like dig into this and make some changes in my life, I'll send them to rosacea.org because it's a great resource for people who are just kind of like, I don't know what to do. I can't get into the dermatology office anytime soon. Or what we've discussed in the office in terms of lifestyle isn't matching up with my flares.
Yeah.
And it'll go into a deeper dive of things that could be potentially causing it outside of the common things.
Yeah. Very good resource there. And of course, we make content on rosacea.
Totally.
And tons of other skin, concerns. So you guys should be following us on social media. You can find me everywhere at Dr. Dustin Portela.
And you can find me at Austin Lee, PAC.
Before we leave you today, we're going to share a couple of our favorite products of the week. The one that I'm going to talk about is the 10% azelaic acid booster from Paula's Choice. This is a really nice, well-formulated azelaic acid. If you have a little rosacea, especially you're getting the pimples with it, that adult acne across your nose and your cheeks, azelaic acid is a great place to start. Paula's Choice, fairly reasonably priced. And so that is one that I would recommend. And that's going to last you quite a while, actually.
Totally. One of my favorite products that I recommend to almost every single patient with rosacea is the Elta MD UV Skin Recovery. This is a sunscreen that you'll put on. It's green tinted, so when you put it on, it will mask some of that background redness. It will provide superior protection. It is a broad spectrum UV blocker, and so you put it on typically in the morning, preferably in the morning, and it will last a good long time if you're not sweating or if you're not exercising, things like that. But we always recommend reapplication. I'm lazy. I'll reapply kind of midday sometimes, and then I'll go throughout, and then I'll maybe do it the next day. But this is a great option for people who have the erythrotelangiectatic, the red background rosacea. It will mask a lot of it and protect you from the sun. And
it's also formulated to be just really hydrating to the skin.
Yeah.
So helping to repair the skin barrier. So it's not just masking the symptoms, but actually making your skin better.
Yeah.
And if you guys have rosacea, we do offer telehealth now. We're going to have a link to that in the podcast show notes through an app called Future Clinic. And I'm currently offering telehealth in Idaho, Utah, and New York. But if I'm not in your state yet, let us know on Instagram where you're at, because I am getting more state licenses over the next couple of months and be available in more states. And rosacea is one of those conditions that's fairly straightforward to treat on telehealth. So look forward to your consultations if you want me to be your doctor.
Awesome.
Thank you for joining us for this episode. If you found it helpful, share it with a friend and leave us a 5-star review wherever you listen to podcasts. And we'll catch you guys on the next episode.